Are your legs and ankles swelling up? If they are, it's usually for one of two reasons. Either your tissues are leaking fluid or your circulation isn't pumping it back out. In many cases, it's both. Things like compression socks, elevating your legs, and massages can give you some temporary relief, but they don't fix the real problem, the leak or the pump. Hello, health champions. Today, we're diving deep into the #1 way to reduce that swelling in your legs and feet. We're going to tackle the root causes, that leaky tissue and the faulty pump. To really get what edema or swelling is all about, we first need to understand the three main fluid compartments in our body. So imagine our body is made of trillions and trillions of tiny cells. Everything inside a cell, the DNA, the enzymes, all the manufacturing machinery, is in what we call the intracellular compartment. Then, separate from that, we have the bloodstream. The bloodstream is like the body's delivery service, circulating nutrients, vitamins, and hormones to where they need to go. And then there's a third compartment. If you picture the skin as an outer boundary, everything that's not inside a cell and not in the bloodstream is in this third space. We call this the extracellular or interstitial space. Now it's completely normal for fluid to move between these compartments. Fluid can leak from the cells into this interstitial space, and it can also leak from the bloodstream. Normally, about 2/3 of our body's fluid is inside our cells. The other third is split between the bloodstream and this extracellular space. The bloodstream holds about 5 to 7%, so that leaves a good 20 to 25% in that extracellular space. And having fluid there is normal. It's supposed to be there. The problem starts when there's too much fluid leaking out, and it's not being returned properly. This is where the lymphatic system comes in. Think of it as the body's cleanup crew. The lymphatic system's job is to collect all this excess fluid from the interstitial space and return it to the bloodstream. It's a crucial part of our detoxification process. It gathers up waste and junk from this space, dumps it back into the bloodstream, and then our kidneys and liver can filter it all out. To make all this happen, our body relies on two very important pumps. The first one is a microscopic powerhouse called the sodium-potassium pump. You'll find hundreds of these tiny pumps on the surface of every single cell. Their job is to maintain a very specific balance, keeping most of the sodium outside the cell and most of the potassium inside. If a cell starts leaking too much fluid, it's often because there isn't enough potassium inside to hold onto that fluid. This little pump works tirelessly, using up a massive amount of energy. In fact, these sodium-potassium pumps account for about 30 to 40% of your body's total energy use every day. They're vital for nerve signals, kidney function, and maintaining electrolyte balance across all our cell membranes. The second pump we need to talk about is the lymphatic pump. We all know about the heart, that powerful muscle that pumps blood around our body. Well, the lymphatic system has its own pump, but it's not a single, strong organ like the heart. It's more of a passive system that works with pressure differences. For example, every time you breathe, the change in pressure in your chest helps move lymphatic fluid up from your lower body and back into your circulation. So to recap, edema happens when fluid pools in that extracellular space. This occurs when there's too much leakage from cells or the bloodstream, or when the pumps aren't working efficiently to clear it out. When that happens, the fluid accumulates and we get that dreaded swelling. But here's a really important question. What does it mean when you have edema? Is it just uncomfortable because your shoes feel tight? Is it just a cosmetic issue because you don't like how your feet look? Or is it a sign of something more serious? The answer is a definite yes. First, persistent swelling often points to a metabolic problem. It can be a sign of underlying inflammation or insulin resistance. Essentially, your body's chemistry isn't working as cleanly as it should. This isn't just about swollen ankles. It means you're at an increased risk for major health issues like cardiovascular disease, type 2 diabetes, and high blood pressure. Second, if you have fluid accumulating, it also signals a pump problem, a breakdown in your circulation. This also has implications beyond just the swelling. You might develop varicose veins, which aren't just unsightly. They can be serious because they increase the risk of blood clots. If a clot breaks loose, it can travel to your brain and cause a stroke. Furthermore, when fluid is stagnant in your lower legs, it means your body can't effectively detoxify and clean that area. This puts you at a much higher risk for developing wounds and ulcers that just won't heal. Now, I've seen some discussions suggesting that the sodium-potassium pump is the main culprit behind all edema. But when it comes to swollen feet and ankles, the reality is that the lymphatic pump is the bigger player. It's probably responsible for about 90% of the issue. That's not to downplay the sodium-potassium pump. We couldn't live without it. One of the main culprits is something called glycation. If you have high blood sugar, you've probably heard of an A1C test. It's a 3-month average of your blood sugar levels. What it's really measuring is glycation, how much sugar is literally getting stuck to proteins in your blood. The higher your blood sugar, the more sugar sticks to your red blood cells during their 3 to 4 month lifespan. This process of glycation makes your blood vessels stiff and less elastic. When they lose their flexibility, they become leakier, allowing more fluid to escape into that extracellular space. And if you have high blood sugar causing all this glycation, you likely also have insulin resistance. When you eat something that spikes your blood sugar, your body releases insulin to manage it. If you do this frequently, your insulin levels stay chronically high, leading to insulin resistance. This, in turn, fuels inflammation, which causes even more tissue damage and increases leakage. It's a vicious cycle. So you see, swollen legs and ankles are more than just a minor annoyance. They are a clear signal from your body that something deeper is wrong with your metabolic health and circulation. Thank you so much for joining me today. I hope this helps you understand what's really happening with your body. If you found this information valuable, please give this video a thumbs up, subscribe for more health insights, and share it with anyone you know who might benefit. See you in the next video.